Good day everyone, so today I'll be going to perform a return demonstration on immediate newborn care. So first I will going to wash my hands. This is done to reduce microorganisms which may cause disease and contamination. After that I will be going to prepare all the materials, which is the weighing scale, the antiseptic solution, the sterile gloves, the working gloves, and also the scissor for cutting the umbilical cord, the tape measure for measuring the baby's circumference, and also the gauze pad and the umbilical cord, and also the vitamin K for the baby, and also the baby's clothes. After this is I will going to identify the infant identity. This is done to ensure that the care has been rendered to the right infant. And after that is I will going to provide comfort for the baby, which is keeping the environment warm. This is done to prevent hypothermia and hypothermia. So I will going to disinfect first before putting on the gloves, the working gloves. After putting on the working gloves, I will going to put the baby into the weighing scale. This is done to determine any abnormalities such as macrosomia. So the baby is in 2.8 kilograms. And after that, I will be going to do the cord dressing. So let's remove the working gloves and wear the sterile gloves. So I have done my gloves. The next thing to do is I will going to properly restrain the baby. Restrain the upper and the lower extremities of the baby. And then after this, I will going to disinfect the baby's umbilical cord, starting from the base going up using the gauze pad. So the first is this right side, from the base going up, and after that the other side. Never retrace the straw to avoid any introduction of microorganisms, to prevent infection, irritation, and contamination. And after that, I will be going to place another gauze pad into the baby's base of the umbilicus cord. So after this, I will going to clamp the baby's cord for about one half from the base. So after this, I will be cutting the cord for 0.5 centimeter above the umbilical clamp. And then express the blood to the gauze pad under the umbilical base. After that, I will going to put another gauze pad This is done to disinfect and pour a disinfectant solution around the baby's umbilical base. This is done to disinfect the umbilical cord of the baby to avoid to prevent the introduction of microorganisms. After doing the cord dressing, I will now going to inject the baby's vitamin K to provide enough vitamin for the infant, and I will going to inject it into the baby's third lateral, in the middle, third lateral aspect of the infant's thigh. So I will position the baby slightly sideward. And then I will going to press the thigh. Now I will going to measure the baby's circumference using the tape measure. So I will be going to start the baby's head. And after that, the baby's chest. And after that, the baby's abdomen. After that, we're going to get the baby's length. And then I will going to record the baby's circumference. After doing the cord dressing and getting the baby's body circumference, I will going to get the baby's rectum temperature. After that is to note the rectal temperature, and after doing so, I'm going to perform initial bath for the baby. So I will now going to hold the baby into a football grip while covering her ears to avoid introduction of water. And then I will going to wash the baby's head with mild soap or shampoo. Initial bath is done to remove any blood clot during delivery from the baby. After doing the initial bath, I'm going to dry the baby and dress the baby. So let's do our hand hygiene first. Before getting the baby dressed. So I have here the baby's clothes, diaper and the baby's mittens, bonnet, and also booties. So let's place the baby into the blanket. And then dress up the baby. And then the baby's clothes. then the baby's bonnet, gloves, then the baby's movements. After this is we will going to place the baby into a blanket or cover the baby into the blanket. And then after this is we will going to place the baby into the crib. So now I will going to shades the newborn eye and apply an ophthalmic ointment and making sure that the tip of the tube will not touch the eye of the infant. So I will going to apply to inner and outer of the eye and then on the other side. So after applying the ophthalmic ointment, I will going to get the baby's vital signs. And then the respiratory rate of the infant. After getting the vital signs, I will now do the aftercare of the equipments. So now I will going to record the procedure done. So the baby's head circumference is for about 34 centimeter. The baby's chest is 30 centimeter, and also the baby's abdomen is for about 33.23 centimeter. So the infant rectal temperature is 37 degrees Celsius, and also the respiratory rate is 41 breath per minute, and the heartbeat respiratory is 115 beats per minute.